Thank you very much, Fiona, and good morning, good afternoon and good evening to everybody who's joined us today. I'm very pleased to be able to take part in this conversation and pleased to follow Dr. Mark Shipp from Australia to give my perspective and a UK perspective on biosecurity governance in the One Health space. And I'm interested too in the poll result there on integration, because that's something in the last 18 months that has been very much in my head. And we'll touch on it as we go through this presentation. If we can move to the next slide, please, Dan. Thank you. So as Mark said, One Health is not new. The term is more modern, but the interaction of wildlife, domestic animals and humans and the disease challenges associated with that have been around for a very long time, and we're very familiar with them. Tuberculosis, for example, in many developed countries, we control that through pasteurisation, but we still have an issue, and an issue here in some parts of the UK, of tuberculosis in cattle linked to an endemic disease situation in wildlife. And rabies would be another example of that. And so economic and health impacts, even at that level. But as Mark said, the increasing human population globally, more interaction and changes in land use, more interaction with wildlife, changes in how we keep our domestic animal population, all gives rise to the potential for new risk pathways for new and emerging diseases, or the diseases that we know well to behave in different ways. And I just wanted to touch on some recent UK examples that highlighted to me the importance of biosecurity in that interface. Now, these haven't been necessarily big or significant outbreaks, but they have had an impact for the humans involved and potentially for those businesses. And one of them we've seen increasingly is the trend and popularity of feeding raw pet food to pets, rather than the sort of whole diets that you can purchase. And people are sourcing these often not through the usual pet food supply route with its various biosecurity controls, but seeking different routes to buy pet food. And what we found is that sometimes the handler gets sick. They haven't appreciated that they're sourcing perhaps through a non-managed biosecurity route, and they haven't appreciated the need to take precautions when they're handling that food and giving it to their pets. And feeder mice for snakes, for example, with salmonella is another good example of that. Petting zoos and farms, very popular, particularly as lockdown is easing in the UK and people are getting out and about again. Some very preventable cases every year pop up of those well-known Campylobacter, E. coli and salmonella in the visiting children. Again, very simple, no regrets measures can be taken to prevent these diseases spreading into people. We in the UK have identified SARS-CoV-2, and I confirmed it in one cat. That cat indeed did come from a SARS-CoV-2 infected household. We've also been looking at the potential role of vermin. Is there a role for vermin in the spread of the virus between people and the environment, recognising vermin in sewers, infected virus in sewers? The conclusion from our risk assessment was that this was very low risk, but it was something that was worth looking at. And finally, over this winter, we've experienced one of our biggest avian influenza outbreaks ever. And as always with these sorts of things, although predominantly our outbreak has, like the rest of Europe, been an H5N8 outbreak, every infected premise is different because people manage their animals in a different way and they interact with them in a different way. And so we've had to adapt our approaches to deal with that, managing the impact of onward spread from an infected premise while managing the economic impact on that unit. And potentially where we had a conservation site infected, they're absolutely excellent biosecurity with insight enabled us to take some very restricted approaches to managing and identifying where infection was and preventing the onward spread of it through a combination of those well-established practices of isolation, testing, surveillance, and so on. And the second one I wanted to raise with people in that context was we had an interesting detection in a captive seal on a wildlife unit that rehabilitates animals where there was a pathway developed for exposure actually around bathing of seals between wild birds and people who had been working with wild birds and the seals. And indeed we detected the virus in those seals. It hadn't spread further on. So a lesson there for all of us that even in small ways, in relatively routine disease control and interaction events, there novel things happen. Next slide, please. So people will be familiar, I'm sure you may use different terminology, but the biosecurity toolkit, the need to invest in prevention and biosecurity and preparation pays back huge dividends compared to having to invest in respond and recover. And this is true both at individual animal level, farm level, consignment level, or at country level, and indeed globally, as we've seen with the COVID pandemic. And there's a number of things that are common across all these levels, and Mark has touched on them. Ongoing investment in science so that we have the latest technology to use. Surveillance, whether it's checking that individual animal or your flock daily to look for changes, or national level surveillance to look at changes across your national level population. Legislation is a really important, although cumbersome tool. We know that if we want to achieve freedom and eradication from disease, we need all actors, all keepers to be taking action, to have biosecurity obligations. Otherwise, we won't achieve that free state that we want. Communication, I can't stress how important this is for me, probably more than anything else, to get communicating clearly and transparently so people have trust in what you're doing and understand why it's happening. That links into, therefore, having assurance and verification, having trained people in veterinary services capable of managing and dealing with issues, and oversight from a trustable, competent authority. And very importantly, it's a team effort. It involves everybody to take action and work together, that integration piece. And we're only, for me, as good as the weakest link in the system. Next slide, please. So thinking in some more specifics here within that biosecurity toolkit, I'm thinking particularly of prevention and preparation in terms of our HPAI outbreak. There were some key biosecurity weaknesses that we have identified. I'm confident from our robust epidemiological investigations of the infected premises we detected that they were all point introductions from the high level of wild bird infection that we were seeing. So there wasn't spread between farms. But what we did see was particularly around bedding and activities people do every day. So bedding kept wrapped outside, wrapped to protect it from the weather, to protect it from wild birds, then taken into or amongst the birds, the kept birds, with that wrapper on. And unwrapped in the shed with all the birds, enabling the spread of infected feces, virus-infected feces, amongst that shed. So something quite simple to think about, a relatively easy change in management practice, but wasn't forefront of people's minds. Another thing we found was really good biosecurity through trained personnel during the week. But often there would be temporary or revolving people on working over the weekend, and biosecurity didn't get that same attention to detail. And when you're facing that high wild bird background risk, 24/7 attention every time you go in to check your poultry, it's really important that you take effective measures. Otherwise, it doesn't take much virus, take them into a susceptible population and you have an outbreak starting. Vaccination and genetic resistance, again, something that we can do at individual farm level, building it into our management practices, but something also very important at the national level in building prevention approaches within our national populations, and the continued investment in research that I've mentioned. I think there's a lot more we can do, and I mean in a UK sense, but probably globally as well, in providing people with the information to undertake more risk-based assessments for themselves in terms of their trading practices. Because although biosecurity can be generic, it's important that you're applying your measures to what your specific risks are for how you manage your animal population. But it comes together when you're looking at the national level in terms of improved traceability, for example. How do we know where animals have been moved from and to? Can we test them before they're moved into their new population to give us that assurance that there is disease freedom there? And then thinking of respond and control and recovering from disease outbreaks, I touched on our investigation of, is there a potential for vermin to be spreading coronavirus in sewers and things, but how do we deal with diseases when they are present in wildlife? And that's something coming back to tuberculosis in the UK is something we have been thinking heavily about, but it's appropriate, you know, to the rabies issue as well. And new and emerging diseases. When we have it in a wildlife population, which is not a kept or controlled population, what actions can we take to manage it? And clearly preventing it happening in the first place is absolutely where you get most benefit. Next slide, please. It's key for me in taking a systematic approach amongst all the actors. And in the UK, this was a finding from Dr. Anderson's reviews of our foot and mouth disease outbreaks in the 2000s, where he said that we should be looking to take a more systematic, consistent and regular approach to new and emerging threats. And so we developed the veterinary risk group cycle. Through a number of different tools for identifying changes and trends, changes in disease detections and so on, we feed them into our veterinary risk group where they are assessed through an ether tool. So this is a systematic assessment and weighing up of what is the potential impact and likelihood of this threat and what could be effective actions for it. It helps us direct resources, it helps us focus resource, and it also helps us to find this new threat might be really important. We need to think more about it. That information is considered by our experts and then fed out to policy owners, those people who can be in ownership of actions, and fed out to industry and livestock keepers as well through their vets to understand where they can take action. And importantly, in the red box there, we feed it to our HARES group. Our HARES group is the Human and Animal Infections Risk Surveillance Group, where we come together in an integrated way to consider potential new and emerging threats. Now, next slide, please.
Yeah, just 1 minute, please, Christine.
Thank you. And this is the same group, but it's just a demonstration with all those boxes. Don't look at the detail of just how many people are involved in feeding information into that cystic assessment. We try to capture everybody across the animal population systems to have a route to feed in. Next slide, please. And this highlights the HARES, which the Chief Medical Officer and I find hugely important, where we have regular systematic assessment of new and emerging threats that may have potential impact for humans. And it enables, when there's headlines around something emerging, enables us to have a risk and science-based evidence approach, an authoritative view on what's going on and how best to manage it. It is a really effective integration for me. Next slide, please. And we involve ministers. I send this up to ministers monthly to enable them to see the consistent where threats that we're constantly worrying about and new and emerging threats sit. It's a very complex slide. It's looking across the whole biosecurity spectrum, not just animal related threats, but it's important that ministers understand that constant changing picture and how to focus resource. Next slide, please. And just a demonstration does include our recent outbreaks of the need to be constantly prepared, to constantly invest in that insurance policy, because you never know when your next outbreak might emerge. Next slide, please. And in managing our disease outbreaks, so in the HPAI that we recently had, again, the importance of really senior people being able to access information from the ground and be kept in that communication loop, so that they appreciate the ongoing need for sustainable funding, the systematic approach, and we're only as good as the weakest link. Thank you very much. I hope that's given you some food for thought